Good evening, everyone. A warm welcome to this special session on color therapy. Because I know many of you had been, almost in dreams also. I think you might be dreaming color therapy, color therapy. So now we are here just for all of you, a surprise class. Because after this class, if you like this class, you'll be having more classes from our Puja ma'am. Okay. So with all your hearts, let us welcome Puja ma'am first time for this Joshi's Kerala group sessions. She has been into color therapy and many other streams in healing as a therapist from almost 5 to 6 years or even more into this therapy. She has been teaching this therapy to so many of her groups. So I request you all to please pay attention to this session. If you have any query, you please note it down in your notebooks and ask it, because the first few hours will be her teachings on cold, cough, and whatever the therapy will be there. So she will cover the subject. After that, you please make note of everything so that you can ask your query. All your doubts should be cleared with this session. So till then, no doubts. You should not raise your hands until the session is over. Okay. So please make sure you all are available with your friends, family, with your notebooks, pens, your mind and presence in this session, please. So with all, I welcome you all to this session. Thank you for attending this session. And please make note that this is a live session. Unless you are also available for this live sessions with your videos, you won't be able to, understand it better. So I request you all to please switch on your videos and please stay alive, as especially give your presence here into the session, because unless you understand, you can't be able to use it effectively for yourself, for your family, or your kids, or friends, or anyone else. Okay. So with all our warm hearts today for this special class, let us welcome Pooja ma'am. A warm welcome to you, Pooja ma'am. Thank you for coming ahead and giving your first session for Joshi's Kerala group. All the best to you. Good evening to you. Please take over the session. Thank you.
Yes, thank you so much for that lovely introduction. And thank you so much for giving this opportunity to, get into this huge group, Joshi Sir's Kerala group. So thank you so much and warm welcome to each and every one of you. Namaste. Sam Pooja Nakode from Bangalore. So I've been into acupressure field from past 10 years. So I've been training many people and yeah, so the journey is very good so far. So today we'll be learning more about color therapy. So some of you might be aware of color therapy, but for some people it's new concept. So we are going to start everything from scratch and I request each and every one of you to switch on your camera. Okay, so this session, I'll tell you now itself, this session is going to be full on practicals. Okay, even if you miss out on single, uh, finger, you won't be able to understand few things. Okay, so I want everyone's attention to be here itself. Okay, yeah, so yeah, fine. So, what is color therapy? What is color therapy? So color in acupressure we have so many categories. So that is seed therapy, magnet therapy, and color therapy, one of the most loved concept by everyone. Okay, so why do we use colors? We all know what is acupressure, so giving pressure on certain points. Okay, we all know we give pressure. So whenever you have headache, we give pressure on our thumb. Whenever you have leg pain or hand pain and everything, so we have specific points for that. Okay, so one second, just a minute. Yeah, so why do we use color therapy? So we can't give pressure for 24 hours, right? So if you have headache or whatever it is, you can't give pressure for 24 hours, not even more than half an hour. Okay, so what we do is we put colors on specific points and just leave it. Okay, and so once you put color, you need not concentrate, oh, is it going to work, is it going to work? So it has nothing to do with your conscious mind. Okay, just apply it and leave it. Okay, so just trust the process of universe, and it starts working. Okay, so when is the right time to apply colors? So everyone says it's only daytime, because sunlight you have to fall on the colors. Okay, so the biochemicals which observes from the skin level, and so the process starts working. But if you can't apply at daytime, it's completely fine. You can apply at nighttime as well. So you can apply at night also and then go to bed. Suppose if you have cough, cold, or headache, or even emotional issues. And let me tell you, color therapy is such a wonderful concept. It not only heals physical aspect but also your emotional aspect. So those who have depression, anxiety, any mind related issue, so it gives best result for that as well. Okay, yeah. So now starting off with the concept. So color has impact in our body. Each color has its different vibration. Okay, yellow color says something, pink color says something. Okay, so we'll be understanding how each color works. Okay, so we have 10 fingers. I hope no one has 11 fingers, just like Hrithik Roshan. Anyone here? Special person? Okay, no one? Fine. So we have 10 fingers, and then we have 10 elements in Ayurvedic acupressure. Under color therapy, we have so many categories. So that is German concept. So that is Dr. Wall's concept. And then we have Patanjali Yogic System of Chakra, TCM, and Ayurvedic acupressure. So Ayurvedic acupressure is very simple. Okay, so let me tell you, this is one of the easiest concept. Okay, so we have 10 elements in Ayurvedic acupressure. So each finger represents each element. Okay, so we have finger numbers. Okay, so I hope you all are fine with switching on your camera. Okay, now I want everyone to sit straight, pay attention. Okay, so keep your hands like this. So this is my right hand and this is my left hand. Okay, so we have finger numbers. So I want you all to start with finger number 1. So this is finger number 1, right little finger. Okay, right little finger is finger number 1. Finger number 2 is your left little finger. Okay, so this is finger number 1, finger number 2. Okay, finger number 3 is your left index finger. And don't worry about the numbers. So we will share one PDF with you all, so you can refer it. So I'll send it to sir, so sir will share it on the group. Okay, so your left index finger is finger number 3. Finger number 4 is your right index finger. And then we have finger number 5, that is right ring finger. Okay, so these are 5 physical elements. So we have 2 categories. So we have something known as physical elements and metaphysical elements. Okay, so first we'll be covering first 5 elements, physical elements. Physical element is something which can be felt, which can be seen. Okay, something which can be touched by human beings. So this is physical element. Metaphysical element is something which is invisible. Though it's invisible, it's present in our body. Okay, so that will be from 6th element. Okay, so I hope you all are ready with finger numbers. So can you all show me finger number 1? 1. Yes. So right little finger. Right little finger is finger number 1. Okay. Yes. So explain once more. Okay. So sir, yes. What do you want me to explain, sir? So okay. So do you want me to explain finger numbers again? We'll start with number 1 to 5. Okay. So
Any
this is
easy ways to remember this, please?
what?
Any easy way to remember this?
Easy way to remember. Okay. So this is the smallest finger. Okay, so it's from height, short to tall. So we had this in school, right? So those are short, stand in front. Okay, so those are tall, go stand behind. Okay, so this is the concept. So which is the smallest finger? No wonder the name itself is little finger. Okay, so this is little finger. So starts from your right hand, right to left, again left to right again. Okay, so this is number 1. Number 2, okay, 3, finger number 3 is left index finger. Okay, finger number 4 is right index finger. Okay, and then finger number 5 is your right ring finger. Okay, so these are 5 physical elements. So later we'll be covering metaphysical element. Okay, now starting off with the first element. So the first element is called Akash. So we have 10 elements. So that is Akash, Vayu, Agni, Jal, Prithvi, Kal, Disha, Man, Atmatam. So we'll be talking about each element in detail. Okay, so the first element is called Akash. Akash. So what is Akash? Akash means sky, space. Okay, so the outermost thing that covers our entire cosmic energy is sky. It has no limitation. So can we even touch sky? Can we touch sky? No. Okay, sky is something which covers our entire cosmic energy, outermost part. Okay, so we have something known as tonification colors and sedation colors. Okay, so let me tell you what is tonification. So tonification means increasing energy. Okay, so please make note of this. So if you have notebook, tonification means increasing the energy. Sedation means decreasing energy. For example, if you have excess heat in the body, what are you going to do? Are you going to tonify heat? We are going to set it. Okay, so this is how we are going to use each element. Okay, first element is Akash. So the tonification color of Akash is purple color. Okay, sedation color of Akash element is dark blue color, indigo, dark blue. Okay, tonification color of Akash is purple. Sedation color is dark blue. So now I'll tell you when to use which element. Okay, I hope you all have sketch pens. So I'll explain what is Akash element, how it works, and then we have full on practicals. I hope you all have sketch pens with you. Okay, if you don't have it, please get one. Okay, fine. So I just told you what is Akash element. So the outermost part of the thing, cosmic energy, cosmic thing. So same thing with our body as well. So what is the outermost part of our body? It's skin. Okay, so those who have any issue related to skin, outermost part of the body skin, right? So we use Akash element. Okay, even when you have ulcer, mouth ulcer and all, right? So how does it start? So it starts from heat, internal heat, and then it's going to reflect on the external part. Okay, so anything, so anything that you come across, the outermost part of the body, outermost part of any organ. So how many of you know what is pericardium? Pericardium is thin layer of skin which covers heart. Okay, each and every organ has thin layer of skin, okay, which covers each and every organ. Okay, so that is one example of Akash element. And let me make it even more simpler. So take an example of any fruit or vegetable. Everything has outermost part. Okay, so even if you want to eat banana, so we peel, right? Okay, everything has thin layer of skin which covers the fruit, vegetable, and everything. Okay, so we have so much of similarity with the nature and our body. Okay, so Akash means sky and space. So let me give you one example of space element. Okay, now what happens when you're walking in the road and suddenly there's a gutter and you fall down? You're not aware, you're just using your phone and suddenly you fall down. What happens? Okay, just because of that space, you're not aware there's a space and you just fell down. Okay, so this is one example of space element. Okay, So we have this space element in our body. Okay. For example, cavities. So cavities, space from cellular level. Okay, just like that, nobody will have cavities, infection, and all. Only if there is space. Only, all these things like, what can I say, infection, viral infection, dead cells will start accumulating in one part of the body. Even belly fat. Only if there is space, fat will start accumulating in one part of the body. So whenever you have belly fat, sagging skin, or even if you have cavities or whatever it is, we are going to sedate Akash element because there is too much of space. Okay, so we are going to reduce this element. Okay, so this is one example of Akash element. Okay, and also Akash talks about flexibility. Flexibility. I'll give you an example. So there are two different ways of giving this example. So by flexibility, I meant body flexibility. If you're not able to turn from left to right side, okay, what does it talk? Stiffness, lack of flexibility. Okay, so those who don't have flexibility, when you're not able to stretch your knees or your shoulders, your hands, your arms, or whatever it is, what you need is extra flexibility. So we are going to tonify Akash element. Okay, how to use colors? So I'm going to explain. So this is how it is, so each and every element has meaning. Everything has different colors, tonification color, sedation color, etc. Okay, now I hope you all have sketch pens. So do you have any doubts regarding this first element, Akash element? I hope you all are enjoying. If yes, just can you all just show like this? Yes, thoroughly, wholeheartedly. Yes, awesome. Glad to know this. Yes, fine. Okay, so now starting off with, okay, so we have something known as insect correspondence. Okay, so we all know insect is something very small. Okay, okay, so same thing when our body as well. So our body is going to reflect on our fingers. Okay, so each and every finger. So this is your head region. All the first phalange is your first thing, that is your head region. Second phalange is your lungs and heart region. This is your lungs and heart region. Third phalange is all about your abdomen organ. So that is your liver, gallbladder, spleen, stomach, large intestine, small intestine, etc. Okay, so whenever you have issues related to anything, so today we'll be covering many topics like cold, cough, etc. So whenever you have cold, cough and everything, right, so we're going to cover this portion, second phalange. Okay, so this is how you're going to start. Now I want everyone to take any color sketch pen. Okay, one warning, one strict warning. So once the session is done, please wash your hands. Okay, because it has impact. Okay, so make sure you all wash your hands. So now I want everyone to draw your eye correspondence on all the fingers. So this is going to be your eye correspondence. So whenever you have eye related issue, this is how we are going to color. Okay, so this is your eye correspondence. Okay, so as of now, you can use only 4 fingers. Okay, so this is your eye correspondence. And then we have nose correspondence. So can you see the fingerprint, everyone? Can you see your smallest circle, your fingerprint, this area? So cover this area. So this is your nose correspondence. So whenever you have running nose, nose bleeding or whatever, we are going to shade this area. Okay, so this is nose correspondence. Okay, and then we have something known as mouth correspondence. So many people assume mouth means only so much. Okay, this part is mouth. Okay, but if you see where's your wisdom tooth, it starts from here to here. Okay, so I want you all to put one rectangle shape. So start from here and then end it over here. Okay, so this is your mouth correspondence. So whenever you have 2-3 letter issue or anything, so by the end of the session, I'll tell you what um, inspired me to learn acupressure. You'll be surprised to know how it worked. Okay, so yeah, this is your mouth correspondence. And then we have something known as throat correspondence. So throat correspondence is nothing but you just have to draw one single line on the first phalange of all the fingers. So those who have issues like throat infection, thyroid, hypothyroid, you can just put one dash, single dash. Okay, and then lung correspondence. So we all know the shape of lungs, so it's going to be something like this. Okay, so this is your lung correspondence. Whenever you have chest congestion, cold, cough, asthma, it works beautiful. So this is lung correspondence. Yes, awesome. Almost everyone. Sushma ji, Sugandha ji, awesome. Everyone. Very nice. Very nice. Okay. So we all know heart is in between our lungs, partially towards left side. So the heart correspondence is going to be like this. Okay. So whenever I say shade on lung correspondence, you're going to shade this area completely. Okay. So it's not just the drawing. You have to shade this area completely with the color. Okay, so this is lung correspondence. Okay, and then this is called heart correspondence. So any issue related to heart. Okay, so this is the correspondence, heart correspondence. Okay, and then this is known as abdomen correspondence. Okay, so this will be learning in further classes. So we have so many organs over here: liver, gallbladder, pancreas, and everything. Okay, so this is your abdomen correspondence. And then, so where is brain? Is it the front side or back side? Where is it? Brain. It's front and back. Front and back. Okay, so yes, so brain also has two parts. I want you to write yin brain and yang brain. Y-I-N, yin brain. Y-I-N, yin brain. Y-A-N-G, yang brain. Yin brain and yang brain. Okay, so yin brain is the front part. So this portion is, the front part. So yin brain is going to be on the tip of your finger. Okay, so yeah, so this is yin brain. So can you see this? So this is called yin brain. Okay, and this is called yang brain, just below your nail plate. Okay, this is yang brain. Okay, and then we have spinal cord. So we all know spinal cord is not in the left or right side, it's in the center part. Okay, so whenever you have spine related issue, backache, slip disc or disc bulge, joint effusion or anything, you're just going to draw one straight line and make sure you extend till your knuckle joint. Okay, so I want you all to feel this knuckle joint. So please extend till here. So this is just like your tailbone. Okay. Yes, awesome, awesome. Very nice. So Mangal ji, Marcy ji, Sushma ji, awesome. Shanmugan sir, okay, awesome. Very nice. Okay. And then we have, okay, last thing is your kidney correspondence. So I've given this protocol to, I think, more than 200 people. Results are fantastic for kidney stones. Okay, so those who have kidney stone, make sure you start. Okay, so I'm going to show. So I want everyone to fold your index finger. Okay, so can you do like this? Okay, so wherever you feel the joint, middle joint, start from here and extend till here. Okay, so this is your kidney correspondence. Okay, Mercy ji wrong. Mercy ji wrong. Sushma ji correct? Yes. Start from here, okay, and extend till here. Make sure the shape is oval. Okay, so this is kidney correspondence. Okay, so I'll give you one fantastic. Uh, okay, I'll give you now itself. So usually I teach this in advanced classes, but so now we spoke about Akash element, right? So back to Akash element. Okay, so we all know this is face correspondence, lung correspondence, heart, and this is abdomen correspondence. Okay, so where is your hands and legs? We didn't cover this part, right? Okay, so hand correspondence is going to be on the sides. So you're going to shade on the sides. Okay, leg correspondence is on the third phalange sides. Okay, so later I'm going to share the picture so you'll have clarity. Okay, so on the sides it's going to be your legs, so that is your thighs and calf muscle both. Okay, now back to Akash element. So I told you those who have belly fat, sagging skin and all, right? So what are you going to do? Are you going to tonify? So can you just show me like this, tonify or sedation? Yes. Okay, we're going to set it because nobody wants belly fat, nobody wants to look fat and everything, right? So can you all tell me the sedation color of Akash element? Yes, it's dark blue. Okay, so what you can do is apply dark blue color on right little finger, third phalange completely. So make sure you shade it on the sides also. So you see hip reduction as well. If your pants are not fitting, okay, you'll see the difference. Okay, so all your old pants will start will start fitting, so you can just try this and see. Okay, so this is to reduce belly fat. Okay, so this is on Akash element. Okay, now moving on to the next element is Vayu. Finger number 2 is Vayu. Finger number 2 is Vayu. Left index finger. Okay, so what do you mean by Vayu? So Vayu means wind element, wind energy. Okay, so I want you all to understand the characteristics of wind element. Okay, so wind has drying effect. Wind has drying effect and also cold. Most of the time it's cold. Okay, okay. So the tonification color of wind element Vayu is dark blue color. Tonification color is dark blue. Sedation color is light blue. Sedation color is light blue. Okay. Now, how many of you, whenever you're cutting vegetables, how many of you just cut your skin by mistake? Okay. So now let's say I'm cutting vegetables and I have one small wound mark. So what will I do? Wind energy. Okay, so whenever you have wound mark, so let it be fresh wound or wound mark which is there from past 7 years, 10 years, this works like magic. All you need to do is apply dark blue color around the wound mark. It's not on the wound mark, it's around the wound mark. Okay, so whenever you have small scratches, cuts and all, you'll have that burning sensation. Okay, no matter how strong or how weak you are, okay, you will have burning sensation. Okay, once you apply dark blue color, you'll feel much better within like you don't even want 2 minutes. Within 1 minute you'll feel better. Okay, so the pain is gone. So blue color is for healing purpose. Okay. So whenever you have fresh wound marks or anything like, even old marks, how many of you have dark patches? You had pimple, but the mark is still there. Yes, Gopinath sir. Okay. Shakuntala ji. Okay, Shakuntala ji is showing. Oh, okay. So, okay, fine, fine. So you can just apply it around that area. Okay. So yeah. So Vayu has drying effect. Okay. And then Vayu has so many qualities. It has cooling effect. Okay. So once you apply the color, it has cooling effect. Okay. When do we sedate Gopinath sir? So Joshi sir, like do I have to take questions now or later, sir? How does it work?
At the end of the session, ma'am?
End of the session? Okay. So those who have any questions, please make note of it. So I'll ask you all later. Okay. Yes. Okay. Shakuntala ji. Awesome. Awesome. Very nice. Okay. I'll just put you on spotlight for just 1 second. Okay. Okay. So can you all see Shakuntala ji's hand? Awesome. We'll wait for your feedback. Okay. Fine. Yeah. So this is on bio element, and also bio element is not stagnant. So when we say wind, it's not stagnant. It keeps moving. Okay. In acupressure, we have so many types of pain: stabbing pain, moving pain, etc. Okay. So wind is not stagnant. It keeps on moving, and so it's called movement. Movement. Okay. Movements, fluctuations, and everything. So whenever the person has mood swings, so one day I'm happy, one day I'm sad, one day I'm angry. Okay, so with something like this, what happens? Your mood is fluctuating because of excess of Vayu element. Vayu element is excess, and that's why I'm having mood swing. Okay, so what you need to do is sedate Vayu element. Okay, sedate Vayu element for those who have excess mood swing. Okay, so the sedation color is light blue. Light blue. Okay, so where do we have to give treatment? So treatment is here, mind, so treatment should be given to the mind. Okay, so we are going to treat on yang brain. So can you all show finger number 2? Finger number 2. Yeah, left little finger. Okay, can you all show me the location of yang brain? Yes, excellent. Anita ji, Shakuntala ji, awesome, very nice. So you just have to apply light blue color. Make sure the shape is circle and shade this area completely with light blue color. Okay, so whenever you have mood swing, so due to mood swing, so many things can happen: anger issue, frustration, jealousy, or whatever it is. If you have negative emotions, so make sure you apply light blue color. Okay, only if it's due to mood swing. Done? Okay. Yes. So don't put it over here. It's not on it's not on yin brain, it's on yang brain. Okay, yang brain. Okay, yes. Excellent. Awesome. Mangal sir, Mercy ji, Shakuntala ji, Kirti ji. Okay, awesome. Very nice. Okay. Okay, Selva Rani ji. Okay, so 1 second. I'll just apply it and show. Some people have just put small dots. So can you see this? This is not the right thing. Okay, so I want you to apply it. So the size should be so big. Okay, so this is the location of Vayu element. Okay, and then due to excess of Vayu element, what all symptoms are there? You might catch cold, cough, etc. So again, we are going to sedate Vayu element. Because of external wind attack, you might have cold cough. Yeah, agree everyone? Winter season. Okay, sometimes it can be due to allergy also. Okay, as a doctor and therapist, it's very challenging to diagnose. So those who are therapists already, you might be facing this issue. How to diagnose? Okay, sometimes you might have running nose due to allergy also. Okay, so those who have cold cough due to wind attack, external wind. Okay, seasonal change and everything. So you just have to sedate Vayu element. Okay, so where do you have to sedate? If you have running nose, make sure you apply which color? Sedation color, light blue. Okay, make sure you apply light blue color on nose correspondence. Okay, and lung correspondence. So whenever you have cold cough, obviously your internal organ, that is lungs, it's going to be affected. Okay, so we're going to sedate by applying light blue color on this area. Okay, I want you all to try right now. Okay, those who have cold cough, please try it right now. If you don't have, please don't try it. Okay, yeah, so this is on, sorry, 1 second. This is not on finger number 3. This is finger number 2. It's on left, uh, little finger. Okay, we put it over here also, to generate heat. We'll be talking that later. So it's on finger number 2. So shade this area completely with blue color. Okay, so this is how it should look if you have running nose and cough. Okay, so if you want, you can take this screenshot. It's on finger number 2. Finger number 2, left little finger. Okay, so this is the location. Yes, okay, yeah, so this is on Vayu element. Yes, perfect. Marsiji, Mangal sir, awesome. Yes, okay, so this is on Vayu element. Actually, the concept is huge. I can talk about each element for 2 hours. Each element, 2 hours. Okay, so I'm just trying to make it short and crisp. Okay, so this is on Vayu element. And then Vayu element also talks about force, pressure. Okay, imagine if there is too much of wind. You're just walking in the road, there is storms, wind. What happens? You feel like you are flying, because of the wind energy. Okay, so it has pressure. So the characteristics of wind element is pressure. So whenever the person has kidney stone, I want to give this remedy. I don't know why, but I just feel like giving this remedy. Those who have kidney stone, what are we supposed to do? Like, can you all show me, is it tonification or sedation? Yes, can you all show me? Okay, no. Now imagine there is kidney stone. So we all know doctor will keep telling drink lot of water. Okay, so when you drink water, somehow it flushes out. So to flush out, what it needs is pressure. So you have to tonify. You're going to increase. Okay, so tonify wind element. So can you all show me finger number 2? This is finger number 2. Where is kidney correspondence? It's behind. Okay, so just take dark blue sketch pen and apply it on kidney correspondence. Okay, so I hope you all know the location and the shape as well. So it's going to be something like this. Finger number 2. Okay, so all you need is push, pressure, force. Okay, so this is on Vayu element. There's so many things on Vayu element. I can just go on and on and on. Okay, and then finger number 3. Finger number 3 is called Agni, right index finger. Okay, Mangal sir, 1 second. Sir, start from here, sir. So it starts from your joint. Yes, sir. Yes. Starts from the joint and extend till here. Sarama Alexander G. Okay, start from here, extend till here. Yes. Isha Ji, correct. Okay, so this is on Vayu. Done. And then finger number 3 is your left index finger. Yes, left index finger. Okay. Agni. So this is called Agni element. Finger number 3. Okay. So what is Agni? Fire element. Fire element. So what are the characteristics of fire element? So when there is fire, what do you feel? Cooling energy or heat? Heat. Okay. So when the person has excess heat in the body, okay, so most of the disease are due to some kind of deficiency, some kind of stagnation or excess heat pattern. Okay, so these are the main things, and we have so many things, stasis, stagnation, and everything. Okay, so most of the time it's due to these three things. So whenever the person has excess heat in the body, just remember one element, and that is finger number 3. Okay. Now, the tonification color of Agni element, finger number 3, is light blue. Light blue. Sedation color is dark green. Sedation color is dark green. Okay. How many of you expected, I would say, red color because it's Agni, fire element? How many of you expected red color? Most of you might be expecting red. Okay, but when I said blue, you were like, okay, how come blue color? Okay, so just take matchbox and just on. So what you get, the flame is in blue color. If you actually see, the flame is in blue color. Okay, so try to avoid light blue cloths during summer season. You can try this if you want. So during summer season, try to wear light color clothes, like green, light green, white color. It has pleasant effect. Okay, so this is the thing. So tonification color is blue, sedation color is dark green. Okay, now when the person has excess heat in their body, so what are the common symptoms? Inflammation, mouth ulcer, dehydration. Okay, there's so many things. You would have come across ads, Colgate ads, dentist ka Sujaya #1 brand. Okay. Yellow teeth, yellowish teeth is due to excess heat in stomach. If you have excess heat in stomach and if you polish your teeth, it's not going to work. Okay. Excess heat in stomach can give you yellowish teeth. Or your mouth will keep stinking even if you brush 3 to 4 times a day. Okay, it's due to heat in stomach. Okay, those who have dark circle, the root cause is heat in liver and gallbladder. Okay, so the root cause is heat in liver and gallbladder. So that will give you dark circle. We all do makeup. I myself love makeup. Okay, but just by doing makeup, it's not going to vanish from the root cause. Okay, so what you need to do is treat from the root cause. Okay, and those who have mouth ulcer, it's due to heat in heart and small intestine. Okay, I've seen so many people suffering from mouth ulcer, 10 years, 15 years. Today I'm going to share that remedy in this session. Okay, once you put green color on both index finger, so I'll show you the location later. So once you try this, the results are fantastic. Okay, you'll forget that you had mouth ulcer. Okay, so many people give up on their favorite food, chapati, paneer, manchuri, whatever it is. Okay, due to burning sensation. Okay, so this is the root cause. And there are so many things, and many people during the month of April, May, June, they get admitted to hospital due to food poisoning. If you have come across food poisoning, they get admitted. So food poisoning is also due to heat in spleen. So we have an organ known as spleen. So if you reduce heat in spleen, it's done. It's done. That's all. Okay. So need not take you know, need not get admitted to hospital and make it so complicated. You just have to understand the logic and use the colors. Okay. So it's that simple. Okay. So this is on heat pattern. So whenever you come across anything related to heat, excess heat in the body, make sure you apply dark green color on young brain. So this will reduce overall heat. Okay. Some people might have nose bleeding due to excess heat. So we all know where is nose correspondence. It's over here. Okay. So make sure you apply dark green color. Okay, so make sure you apply dark green color on finger number 3. Okay, nose correspondence. Okay, and okay, so when do we have to increase heat? Any idea when do we have to increase heat? Most of the time we are sedating, but when are we increasing? Okay, so when the person has cold, cough, okay, and there's too much of internal cold or due to even external cold, what you have to do is you have to generate some heat in the body. You have to generate heat in the body. Okay. So at that point of time, we use tonification. So the tonification color of Agni is light blue. So those who have running nose, immediately just try this and let me know the feedback. Apply light blue color on finger number 3. Lung correspondence. Even if you have running nose is again due to external wind factor. So make sure you're tonifying so that you're generating some heat in the body. Okay. So this is on nose correspondence and lung. Okay. So this is on Agni element. And then we have Jal element, finger number 4. Finger number 4. Can you all show me your right index finger? Finger number 4. Okay. Finger number 4 is Jal. Jal is water element. Okay. Tonification color of Jal is dark green. Okay. Sedation is yellow color. Sedation is yellow color. I want you all to write colors because many people, I know some people, some of you are new to this concept. Okay. So I want you to make note of it. Okay. Fine. So when do we have to increase Jal element? अपना दिमाग ठंडा रखिए. Have you come across this sentence? Okay. If the person is has a lot of anger issue, okay, दिमाग ठंडा रखना. Okay, so this will keep your mind calm. Number 4, Jal element. So all you have to do is apply dark green color on finger number 4. Okay. So I do numerology also, like I can connect with everything. So number 4 also talks about letting go of something. Okay. So many people have relationship issues, or what I can say is forgiving. Forgiving someone can be very difficult. How many of you agree with this? Forgiving someone is a very big task. Okay. Okay, so we created internal blockages, emotional blockages. Okay, and we create stones like kidney stones, and we'll have disease and everything. Okay, so forgiving is very good. So try this if possible. One second. Okay, so those who have issues, with forgiving or to let go of anything, those who have grudges, forgiving issues, or to let go of any thought that bothers them a lot, make sure you tonify finger number 4, gel element. Make sure you apply dark green color. Okay, so you'll just go with the flow. How many of you are aware of chakras? I think 95% of you are aware of chakras. So if you know the color of heart chakra, it's green color. Okay, so this is how I can connect with everything. Finger number 4, dark green color. Okay, and those who have excess heat in the body, whatever I'm giving you is like advanced protocol. So don't be like, okay, it's free session, only basic concepts are covered. Okay, so those who have excess heat in the body, make sure you apply dark green color on both index finger, yang brain. If you have dehydration, if you have excess heat, sweating, or whatever it is, okay, make sure you apply dark green color. Okay, so this is on gel element. Okay, and you have so many things on gel element. Number 4. Okay, when do we have to reduce gel element? When the person has bleeding, nose bleeding. Bleeding is also in the form of liquid, water element. So we're going to sedate which element? Gel element. When the person has running nose, sedate water element. Okay, so what can you do when the person is having cold, running nose? Which color are we using? Yellow color. Okay, and the correspondence is on nose. Okay, so make sure you apply yellow color. Many people think yellow, if you just apply yellow color, it's not visible. So can you see yellow color? Can you see blue color? It's highlighting. Okay, yellow color, it's not even visible. If I show you from here. Okay, but still, if you apply yellow color, it works, because the energy is different. Okay, so each color has its own energy. Okay, so don't underestimate. Okay, so this is on finger number 4. Okay, yes, and then we have Prithvi element. Finger number 5 is Prithvi element. So that is a right ring finger. Right ring finger. So how many of you know mudras? Okay, so it's called Prithvi mudra. Okay, yeah. So finger number 5 is Prithvi. So the tonification color is yellow. Sedation color is orange. Sedation color is orange. Okay. So number 5, Prithvi talks about stability. 5 is all about strength, stability. Okay. The process is slow. Okay, so do you think earth will just rotate and like just come within like 1 to 3 days? It needs 365 days to complete one rotation. Okay, so the process is slow. Okay, many people will like give me protocol for belly fat, weight loss, and everything. Do you think within 2 days you'll become slim and look like supermodel? No, the process is slow. Okay, so I want you to understand. So why I give such examples, so it will be easy for you to understand. Okay, so the process is slow. Okay, but the results are fantastic. I can assure this. Okay, finger number 5 is all about stability. So when the person is not stable, okay, when the person is having too much of mood swing, okay, when the person is not flexible, okay, today you are my best friend, tomorrow you are my enemy. Okay, so when the person has too much of stability issue, make sure you apply yellow color on finger number 5, yang brain. Okay, so this is on number 5. Okay, and then number 5 also talks about hardness. Okay, And then 5. So when do we increase number 5? Okay, so when the to increase stability. Okay, and those who have constipation and all, right? Those who have constipation, loose motion, we use Prithvi element. Okay, so we all know how the condition, the condition of constipation, it's hard, the stools are hard. Okay, so what are we going to do with Prithvi? Are we going to sedate or tonify? Yes, awesome. Yes, it's sedation. Okay, so the sedation color is orange. Okay, so what you have to do is, we all know the shape of large intestine. So it's just like square question mark. So just a minute. So make sure you take orange color sketch pen and draw this. It's like a square question mark. Okay, so this is for constipation. Okay, but if you have loose motion, what are you going to do? It's awesome. It's tonification. So the tonification color is yellow. Okay, for loose motion, it's yellow. For constipation, it's orange color. Okay, yes, and we all know uh, about kidney stones. So stones are hard, right? It's not soft, spongy type and all. Okay, so stones are hard. So to reduce that hardness, this is again the protocol for kidney stone. Okay, so make sure you have orange color and make sure you put it on kidney correspondence, oval shape. Okay, so this is fantastic protocol. Okay, and then I give you one more protocol to reduce belly fat or to even to lose weight as well. Okay, so this is our abdomen area. So make sure you cover this area completely with orange color. Okay, but one warning, I'll tell you the side effect also. Okay, whatever it is, I'm going to be transparent. Those who have piles, dry piles, constipation, strictly you're not supposed to use belly fat protocol. Okay, because I had given this warning. So when I used to conduct sessions, but the person was like, no, I want to look slim and very nice. I was like, it's up to you. After trying this, she had bleeding piles. Okay, so just be very careful. So if you have constipation, dry piles or bleeding piles, please don't go for it. Okay, yes. So this is on Prithvi element. Okay, yeah, and yeah, so that's it. I hope you all enjoyed the session. So this is on 5 physical elements. Okay, and 5 metaphysical element is something which is invisible. So 6th element is time energy. Okay, 7th element is all about direction. Okay, so Joshi sir, are you there? So can I take Q&A session, sir?
Yes, please. Before this Q&A session, we want someone of you to please give a synopsis of this session so that ma'am will know how you understood this session. Whoever has made notes, whoever is ready, we request you to raise your hand and switch on your video so that you can just give a synopsis of this session.
Yes.
Are you there, anyone?
Yes, I think
Mercy.
Mercy ji. Okay.
Yeah.
Yes, go ahead, Mercy ji.
One second.
Yes, yes.
Yes. So, ma'am, please go ahead. Please make it a short one because we have a question and answer session also. So,
Okay, ma'am.
Mercy,
Okay,
ma'am,
ma'am.
short and
Ah.
sweet. Thank you.
Okay, ma'am. Okay, ma'am. Good evening, ma'am, and good evening to all.
Good evening.
Pooja, ma'am, you took color therapy. You said 5 fingers. First one, right little finger is Akash. It is
Yes.
tonification is purple and sedation is dark blue. It
Yes.
is a sky space and it has no limitation. It covers all the cosmetic energy. And the second is light left little finger. It is Vayu. It's a wind as uh, drying effect.
Yes, it has
And it is moving. And it is moving. It is tonification is light blue. Sedation is light blue.
No. Tonification is dark
Tonification is
blue.
dark blue. Sedation is light blue.
Yes.
Third, light index finger. It is Agni,
index.
fire.
Left index.
Left index finger is Agni,
Yes.
fire.
Yes.
Its tonification is light blue.
Yes.
And sedation is dark green. Fourth one, right index finger. It is Jal Tattva. It is a dark tonification, dark green. Sedation, yellow.
Yes.
Fifth one, right ring finger. It is a Prithvi. It is a tonification is yellow. Sedation is orange.
Perfect.
And when we tonification is increase energy, sedation is decreasing energy.
Yes.
Pericardium there is a thin layer of heart covering like fruits and vegetables. Space is a cavities of cellular level. Talks about flexibility. It can't flex or can't bend or any movements. Tonify, then Akash.
Akash.
Insect brain is in two parts, yin and yang. Then yin is frontal area, yang is the back of our head. If you have any wounds while cutting vegetables, you put around the wound dark blue round. And if anybody's have mood swing, sedate Vayu, that is mind place, light blue.
Yes.
Back of finger, that is below little finger, nail, light blue. Sedate wind,
yes.
light blue, no ma?
Yes, light blue.
Sedate wind on nose and lung correspondence in the road. In the road, when we feel too much wind, characteristics of wind is a pressure. So that time tonify wind. Excess heat is tonify with light blue. Sedate dark green. In because of so much of heat, inflammation, mouth ulcer will occur. Excess of heat in the stomach gives yellow color in the chest. In heat, it is heat because of heart and small intestine. So in month of April, May, June, patients are admitting in the hospital because of food poisoning. That is because of heat in the spleen.
Yes.
And if anything during because of heat, nose bleeding, index finger nose place light blue on finger number 3, lung correspondence 25. When the माँ ठंडा होती है एकदम बोलते gel tatwa. So that time we have to tonify dark green on both index finger and on number 4 to decrease gel element, nose bleeding and running nose correspondence yellow color. On number 5, stability is a strength, not flexible and hard. It is the process is low. So yellow color on yang brain on finger number 5 to increase stability. During constipation, use Prithvi, use orange and sedate. Loose motions, tonify Prithvi and use yellow. To reduce belly fat, number 5 finger lower part yellow color. But if you have piles, bleeding, constipation, don't use yellow color. This is what I wrote, ma'am.
Oh, okay. Okay. Yeah. Fine,
Uh,
fine. Okay, nice explanation,
our,
Mercy ji. But the
uh,
last thing, what you mentioned was for belly fat, we're
uh,
going to reduce. Nobody wants belly fat. So you mentioned apply yellow. It's apply
hmm,
orange color.
yellow. So
Orange.
if they're having piles or constipation, no, don't use yellow color.
Don't use anything. Don't use anything.
Okay.
Yes, yes.
Hmm.
Okay. But for belly
Hmm.
fat reduction, it's orange. It's not yellow color.
Okay, ma'am.
Yes, yes. Okay, awesome.
Thank
Okay,
you.
ma'am, thank you
Thank you
for
so much, ma'am.
giving the synopsis.
Thank you. Thank you.
And ma'am, please correct your last belly fat with orange color. You had written yellow. So Mercy ma'am, please correct it with orange. Now we are going, see, so far someone started complaining. It's a big question. No, it was not a big question. She was actually giving the synopsis of, Mercy ma'am was giving the synopsis of the session. So please understand, that's why I asked you to be present in this session, so that you can know what is happening in the session. When you're out of the session, you won't be able to ask query also or understand what is happening in the session. So every minute of the sessions are very important, because unless otherwise you listen, you can't understand. So without wasting time, now I ask you to raise your hands, and please remember you have to switch on your videos. Okay?
Yes, please. I want to see everyone's face. Your beautiful
And
faces, everyone. Hello. Yes.
I again request all of you, those who are raising hands, please switch on your videos. Madhubala ma'am, are you there? Please unmute yourself.
गुड इवनिंग मैम।
Good evening, Madhubala ji.
मैम मैं थोड़ा हिंदी में बोल सकती हूँ?
Yeah, sure. बोलिए Madhubala ji.
हाँ मैम, एक तो मेरा क्वेश्चन ये था जो आपने बताया, अगर कॉन्स्टिपेशन है
Yes.
तो ये जो राइट हैंड रिंग फिंगर एंड जो ये नीचे का फ्लेंज जो है, इस पे आपने जो ये बनाया स्क्वायर क्वेश्चन मार्क,
Yes.
ये अगर पाइल्स हैं एंड तो उसके ऊपर क्या बना सकते हैं इसको फॉर कॉन्स्टिपेशन? पाइल्स तो कॉन्स्टिपेशन की वजह से ही आती है।
Yes. 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 Yes, Madhu ji.
ऑरेंज कलर से ये बना सकते हैं?
नहीं, आप अपना एक मेथी सीड डाल दीजिए ये पोर्शन में। फिंगर नंबर
हाँ जी
5 फैलेंज है ना, ये थर्ड फैलेंज, यहाँ पर
हाँ जी,
फुल मेथी सीड से कवर कीजिए मधु जी, इससे बैलेंस होगा।
ओके
नो
मैम।
कलर्स।
एक और क्वेश्चन था मैम।
हाँ
मैम
सर।
ये जो आपने बताया जो स्किन में जो होता है, जो ये स्पेस का जो बताया आपने, तो
यस।
जैसे स्किन में जैसे स्किन डिजीज होती है, रोजेशिया वगैरह जो है, ये सब क्या ये स्पेस की वजह से है या एयर की, ये जो अपना विंड की वजह से है?
ओके, सो स्किन रिलेटेड इशू भी बहुत रीजन से होता है मधु जी। इट कैन बी ड्यू टू
Ma'am,
ऑटोइम्यून।
she's asking in Hindi, but you please explain in English so that everyone can understand, because they are, she can understand English also, I guess. So
Is it
please
okay?
explain in English.
Yeah, ma'am. I can understand but can't speak much.
Is
That's
it
why
okay? No issues. Yes, yes. So skin disease can be due to many things. You know, it can be due to excess heat. Okay, psoriasis, eczema, everything. Okay, and then those who have autoimmune disease can also have skin related issues. So the root cause is different for everything. It can be due to allergy, it can be due to infection. Okay, so finding root cause is again important thing, but I'll tell you one thing. So those who have skin related issue, so make sure you apply purple color on the lung correspondence and large intestine correspondence. So Madhuji, just try this and just keep me posted after 2-3 days.
ओके मैम।
Yeah.
मैम ये जो मैं बता रही हूँ, ये रोजेशिया जिसको है, वो उनको हीट से ही है, अगर एक सेकंड के लिए वो धूप में चले जाते हैं तो हो जाता है। एंड शी हैज सोरायसिस आल्सो।
Psoriasis. Okay. Then you can use number 3 also. Finger number 3, finger number 4 also. Make sure you apply dark green on both index finger, lung and large intestine correspondence. Yes, welcome. Yes, yes, yes. Next question.
Now on, I request only one query by one person, please. If we have time, we will take the second query.
Yes. Actually, I have another meeting in like
Yeah.
10 minutes. So yes.
Fine. So within 10 minutes, we'll end this session. So
Yes.
I want you all to finish all the queries super fast with one query each.
Yes. Sandeep sir. Yes.
Smita?
Yeah,
Please.
this
Please
is
go ahead.
Sandeep. Told, two things. That is one, when we have seasonal cold, you told to finger number 2 to write, apply light blue color.
Yes.
And then in another one, there is a yellow color if you have running nose.
Yes. Yes.
So do we have to apply in both the fingers here?
Yeah. Yes. It's simultaneous. So you can
Okay.
apply two set of protocol at a time. Yes.
Okay.
Yes.
And ma'am, for excess heat in the body,
Yeah.
like, foot and hands burning, what can be done?
But sorry, I didn't get your last question.
Excess heat, due to that heat, foot burning and hands.
Actually, foot burning, she's asking. Foot and hand burning.
Okay. No. Okay.
So what can we use?
Yes. So foot burning can be due to many reasons again. Like those are diabetes can also have foot burning. But if you don't have foot burning and all, you can just use the simple protocol. So reduce heat. So make sure you apply dark green on both index finger.
So dark green on both index will reduce fever also?
Fever also, yes. Definitely yes. Because when the person is having fever, body temperature is high. So we're going to reduce it. Yes.
Yes, ma'am. This is Sandeep.
Hello,
My
sir.
question. Good evening, ma'am.
1 second, Mr. Sandeep. I think I don't know how it became up and down. 1 second. I will unmute you after this, and I think you will be the last person to ask. Rajeshwari, ma'am.
Yes, madam. Madam, good evening, madam. Covered all the within a short time. Covered all the points, madam. I want to know the protocol for the urinary tract infection and IBS, which is very common. And another thing, you have told that applies dark blue color around the wound and all that. In the any moles, anything, we can apply that color up. The dark blue?
No. Those who have moles, those who have warts, the root cause is different. Here, if you have inflammation, you can use blue color.
Only.
Yes.
Then urinary tract infection and IBS, the protocol.
Yes. So those who have urinary tract infection, those who know Tulyatata concept, I mean the basic concept, Sujoka, whatever, make sure you apply black color on both hands, in between these two fingers. So this is the location. This is fantastic. Like, trust me, like many people have, I don't want to say, but they've spent a lot of money doing this, that, but this is the best protocol. Both hands. So this is the location. Okay. And those who have IBS, I would suggest methi seed because color therapy, it's again, we have set of protocol. For IBS, make sure you put methi seed on both little finger upper joint. Those who have constipation, loose motion, IBS, this is the protocol. Just like a ring, you just have to put methi seed with the help of surgical tape. So I hope I answered your question, Rajeshwari ji. Okay, you're on.
Sandeep sir, please.
Ma'am.
Yes, Sandeep sir. Yes, sir.
Yeah, ma'am. Actually, having the issue of sweating on the head while having the meals.
Okay, yes, sir. So sweating.
खाना खाने के समय ही पसीना आता है.
Okay, yes, sir. So sweating, so just make note of this, everyone. So sweating on palm can be due to spleen deficiency. Palm. Okay, so I'll be covering this part. I want you all to write this. When you have sweating on your scalp area, this can be due to heat in stomach. Okay, this can be due to heat in stomach. So you can do one thing, sir. Just apply dark green color on both index finger abdomen correspondence, sir. And also young brain, dark green color. Just try this and just keep me posted after 2 days. Yes, sir.
Ma'am, we are taking one more query, last query.
Yeah, sure.
Okay, one last query. And
Yes.
who is that? Kirti.
Yes.
Yes.
Thank you to
Finish.
unmute me, ma'am. Thank you. Actually, I want to ask you, liver and gallbladder, you had connected with dark circle, if it is there.
Yes.
So we should sedate or tone like that. I want to ask.
Okay.
Finger
So
number 3 you
obviously,
told, no?
no, obviously we're going to sedate, reducing the heat. Okay. So do you know which organ is connected to your eye? Anyone? It's liver.
Liver?
Yes, it's liver. Okay. So we keep telling children not to watch television, use smartphones and everything. Okay. Obviously, their eyes is going to damage, and internally your liver is going to damage. If your liver is damaged or whatever, if you have deficiencies of liver and all, you will have that anger, frustration issue, because the emotion of liver is anger, frustration. Okay. So when you have dark circle or whatever, dark circle or excess heat, make sure you apply dark green color on both index finger, eye correspondence and liver correspondence. So liver correspondence, I'll just show the location. So this is the location. So it's like a triangle shape. Okay. So make sure you apply it on both index finger. Okay. Yes. I hope I answered your question, Kirtiji.
Yes. So now today, thank you so much for coming and giving such a wonderful class for all of us. I trust all of them have understood. And now I want all of you to go back, members, please go back to the group and give your feedback about this session, what you learned, how you learned it, how is the session. I want every single detail of this session in the group. Okay. And as Madam is Hari, all the feedbacks goes back to the main group. Ma'am will go and check it from there. So please go, hurry and finish your feedbacks. Queries, whatever is there, you please go and mention at Pooja ma'am and finish all your feedbacks and queries and whatever. Okay. So with all your gratitude, I send gratitude to Pooja ma'am for this wonderful session from Joshi's Kerala. Thank you so much. Good night to all of you. See you again next time.
Thank you, everyone. See you. I hope you all enjoyed. Thank
Yeah.
you.
Thank you
Namaste.
so much. Good night, everyone. Bye, ma'am. Thank you.
Bye-bye. Take care. Bye-bye. Bye-bye.